Kidney stones. We'll talk about kidney stones. So kidney stones. I could talk about kidney stones for ages and ages. So kidney stones are very common here in America. The most common type of a kidney stone is a kidney stone which is formed from the salts calcium oxalate. So everyone is quite familiar with calcium, but people are not as familiar with oxalate. This is the one disease where drinking a lot of water is beneficial. Okay, so by and large, people consume all this water, but the kidneys just then get rid of it if it's not necessary. It's important for us to keep well hydrated. I don't refute that. However, in terms of having a prescribed amount of water for everybody every day, this doesn't make any sense because people have varying degrees of, dehydration or need for water on a variety of days, depending upon the environment, who they are, what they're doing, what they're eating, or the things they're consuming, of course. And so there's no set specific amount of water that we should drink. By and large, if you're thirsty, drink. If you're not, you don't have to. Now, this is not common knowledge. People think that you need to drink 64 fluid ounces a day and so on and so on. It's not quite true, but certainly stay hydrated. Now, if you have a tendency to form kidney stones, we ask people to produce over 2 liters of urine per day. To do that, speak to your doctor about how to know how much urine you're producing. Typically, I ask people just to collect it for 24 hours, measure and tell me how much using jugs. So that's the only good way to really prevent kidney stones that people should really commonly do. Now, if you have a tendency to keep forming certain stones, there's a variety of different things that we can do. As a nephrologist, we like to work with the medical aspects of treating kidney stones. This would be to analyze the stone if we get one. We ask patients to sieve the urine, collect the stone, send it for crystallography, know what type of salt that it is that's producing the stone. The other thing that we can do is a 24-hour urine collection to analyze any predisposition that patients may have to forming stones. And we can analyze it and discuss potential management strategies with patients. Now, say they form calcium oxalate stones. We ask them to drink more fluid. We ask them to decrease their salt intake, which is also important. We ask them to decrease the oxalate in their food as well. We don't, and this is important, ask them to decrease the calcium intake. We ask them to maintain a good amount of calcium intake, primarily because we need calcium, of course, for strong bones and good muscle function. However, it also binds oxalate in our foods, and so it passes through us. We poop it out, and so we decrease the absorption of oxalate. Oxalate's in a long list of funny foods, spinach and rhubarb and chocolate and teas and things like that. And so you can find the list of different foods off the internet if you do tend to form kidney stones. Now, they're not the only type of kidney stones you may find and form. Other things include uric acid kidney stones. And so in that case, we may recommend specific medications, like, for example, the gout medications would help to do that, or citrate as well. For calcium oxalate, we may also recommend something that will make the urine alkalinized, which decreases the precipitation of the salt in the urine. That would be potassium citrate. We can also give a medication that can help reduce the amount of calcium in the urine. These are typically types of water pills, the thiazide water pills like chlorthalidone, or hydrochlorothiazide, which we would use twice a day. Other stones are much less common, but do happen. Calcium phosphate stones, struvite stones as examples. Staghorn calculi, of course, these big enormous stones. And so speak to your doctor specifically about these different stones if they're caught, analyzed, and you have an answer. Now, when stones get over a certain size, typically over about 5 millimeters, as they pass down into the tube between the kidney and the bladder, they can get lodged and stuck. If that happens, then it's a very, very painful situation. Typically, people need to go straight off to the hospital to be evaluated, managed, and treated. When this happens, we need to call in our urology colleagues so they can help extract them. And there's a variety of different surgical techniques the urologist would do so, including ultrasound lithotripsy. They may go into the bladder with a camera, go with a small camera and catch the stone, bring it out, or break it up with laser therapy, for example. But all of this would all be addressed by our urology colleagues.